Hello, and welcome to another edition of the Eye Associates Sight for Life and so much more. I'm Jill Graw, Patient Care Coordinator at the Eye Associates, where we offer customized vision. I'm proud to say that we've been repeatedly chosen as Best Ophthalmologists, Best Optometrists, and Best Eyewear. The Eye Associates is proud to be a Zeiss certified practice, providing the highest quality lenses to give you the very best vision. Today we will be talking with Dr. Scott Hahn and Tina Wood about the advanced technologies of optical products such as eyeglasses, sunglasses, and contact lenses. Welcome, Dr. Hahn. Welcome, Tina. We'd like to start off by asking our panel to tell us a little bit about themselves. Dr. Hahn?
Hi, I'm Dr. Scott Hahn. I am a board-certified optometric physician at the Eye Associates. I've completed additional residency training in ocular disease. I am a fellow in the American Academy of Optometry and a diplomate in the American Board of Optometry. I serve on the board of directors for the Lighthouse for the Visually Impaired, and I've been helping patients at the Eye Associates since 2003, and I see patients of all ages.
Well, we're glad you're here. Tina?
My name is Tina Wood. I'm a Florida licensed board certified optician. I'm also a master optician through the American Board of Opticianry, and I've been in the optical industry since 1984.
Well, Tina, I'd like to brag on you just a little bit. I understand that there are actually less than 400 master opticians in the entire U.S. Congratulations.
Thank you. It was a lot of hard work, but I am very proud of it.
That's very impressive.
Thank you.
Tina, tell us, what are some of the things that the Eye Associates do differently that improve a quality of patients' vision?
Well, at the Eye Associates, we have over 15 board-certified physicians. We have certified technicians and the largest staff of licensed opticians in the area. We also want to bring to our patients the latest advancements in technology, and one of the ways we do that is through the Zeiss lens products.
We're also very involved in clinical research. At the Eye Associates, we perform many FDA clinical studies. This allows us to offer our patients new medications, new procedures, and new treatments that they wouldn't find elsewhere. This allows us to really provide customized vision for our patients.
Well, now, Dr. Hahn, you mentioned customized vision. Can you tell us a little bit more about that?
Sure. At the Eye Associates, we know that patients are individual. We believe that. We understand that. And we know that there are different treatment options for patients, and not one treatment fits all. So at the Eye Associates, being one of the few full-service eye care practices in the area, we can offer all the treatment options. So for example, if you go to an eyeglass place, well, they can treat your vision with eyeglasses. If you go to a LASIK center, then they can treat your vision with LASIK surgery. But at the Eye Associates, we can provide all of these things. So whether you need glasses, contacts, or surgeries, we can provide the best treatment custom tailored for you. That means that we can provide customized vision and give you exactly what you need.
Well, Dr. Hahn, I know that the Eye Associates is a certified Zeiss practice. Can you tell us a little bit more about Zeiss?
Well, Zeiss has been known as a world leader in optics for over 160 years. They are very recognized for their high quality, precision, medical and surgical equipment. In fact, we use some of the Zeiss equipment in our surgery center, and we use it in our medical offices. They've also gained some acclaim from their camera lenses and binoculars and telescopes. Their lenses were used in films such as Jurassic Park and Lord of the Rings. They've even won some technical Academy Awards. They've been part of the space program, so Zeiss lenses were used to capture the first steps on the moon. And Zeiss now manufactures eyeglass lenses that we can offer for our patients. Even famous people are wearing Zeiss lenses. We have Elton John, and even the Pope wears Zeiss lenses.
Well, Tina, as a master optician, do you think that Zeiss lenses are really different from other lenses that are on the market?
Oh, absolutely. And it's the Zeiss technology that makes all the difference. We want to be able to offer our patients superior lens products that's going to give them superior vision. And with the advanced engineering of Zeiss eyeglass lenses and sunglass lenses, we're able to do that.
Well, Tina, you know, driving is, as far as being safe, is a huge concern for our population. I heard that Zeiss actually makes a lens that can help people see better when they're driving or help their driving vision. Can you tell us more about that?
Yes, it's called Drive Safe. And it's a wonderful new product that they have developed. You know, there's traffic is so bad, we really don't want to worry about our vision. So Zeiss has taken patients and addressed their concerns that they had with their vision. With this new lens, the interior of your car, the instrument panels, your GPS, your backup cameras, all of that is much clearer. They have much wider areas. At nighttime, the bright blue lights that we're now dealing with that are very glary, they have a anti-reflective coating that'll reflect that blue light off, so it's not as uncomfortable to drive. And they've also made the driving where there's less head movement, so you can see out the side mirrors through the sides of the lens rather than having to fully turn your head back and forth.
You know, poor night vision is one of the #1 complaints that I hear from my patients. Just the other day, we had a patient who actually had to stop driving at night because her vision was so reduced she didn't feel comfortable. Of course, for her, we recommended the Drive Safe lenses to block some of that glare and to help with her nighttime vision, and she's doing much better now.
Oh, I'm sure she's happy. But tell us, Dr. Hahn, how was the Drive Safe actually developed?
Well, I was fortunate enough to speak with some of the Zeiss engineers, and they were describing some of the methods of correcting and reducing some of this glare that we are all experiencing. And you know, one of the methods is to actually use a tinted lens. So some of you may have seen lenses that have different tints, brown or yellow tints, to help with nighttime vision. And so I was actually looking at a demonstration where I put these tinted lenses on, and I could see that yes, the glare was reduced. But what I didn't know is that after I took those lenses off and put on a pair of the Drive Safe lenses, there was actually a mannequin of a child that I just couldn't see. That's because the tinted lenses change the color vision perception, and at night that can actually be very dangerous. So when they developed Drive Safe, they wanted to help with the glare and the halos, but not alter the color vision so that you can see all the things in your environment clearly, being safe for yourself and everyone around you.
Well, you know, Dr. Hahn, these days everyone has a digital device. And I know myself, by the end of the day, my eyes are tired. Does Zeiss have anything that could be helpful?
So Zeiss knew that this is a unmet need. You know, I remember when I first started examining patients, I used to ask them, if they work on a computer. Well, nowadays, of course, we all work on a computer. So now the question is, well, how many hours are you on a computer? And so with everyone doing so much more computer work, tablet work, digital device work, Zeiss has actually created something called a Zeiss digital lens. So this is a product that helps reduce some of the accommodation and strain and fatigue when we're looking at these digital devices. And this is for people who have a prescription, or even people who don't wear glasses. So people who have great vision far and close, but they want something to help with some of the strain on a computer, they're good candidates for this Zeiss digital lens.
Mm-hmm. Now, Tina, as you know, I work many hours on a computer. Do I really need to have a separate pair of glasses when I'm working on my computer?
Well, let me ask you this. When you're out on the golf course and you're wearing shoes that are appropriate for the golf game, are you going to wear those same shoes when you go out to dinner?
Nope, indeed not.
No. So just like we have different shoes for different activities, we need different glasses for different activities. We don't use our eyes the same way we did 5 or 10 years ago, and one pair of glasses isn't going to meet the day-to-day needs that we have. Zeiss has analyzed how we function in the workplace, and they've not developed one but 3 new lenses that allow you customized vision. You'll sit down with the optician and they can talk to you about how you use your eyes at work and recommend the best product for you.
We also have another option for heavy computer users. We have a complete eyeglass system called Gunner Computer Digital Eyewear. It was made popular by people who play lots of video games because they're staring at these digital devices for long periods of time. And it's a system. It's a system of a frame and lenses. The frame actually has a special curvature to it, which helps to retain moisture. As you stare at computer screens or any digital device, our blink rate reduces. That means we're not blinking enough. So our tears evaporate much more quickly. That increases dryness on our eyes, which then makes them tired and uncomfortable and makes our vision blurry. So Gunner lenses and Gunner glasses have special curves that hold that moisture in. They also have anti-reflective lens treatments. So, overhead lighting that may be coming in from the window, we can block and reflect some of that light that is bouncing off of our of our devices. And then there is a special tint that helps improve contrast. You know, it's much easier for the human eye to look at words on paper than it is to look at them on a digital screen or device. So the Gunnar lenses actually improve that contrast more like we would see on paper, which then helps reduce fatigue, and then that allows us to work on the computer longer, less strain, better for our eyes.
Well, you know, I actually have 2 pairs. I keep one on my desk, and I have one at home for whenever I'm on my iPad or whatever, and it really does help. But now, Dr. Hahn, what about all this talk about the dangers of blue light? Is there anything or a product that can protect our eyes from blue light?
So the American Macular Degeneration Association says that blue light increases our risk for macular degeneration. Now, blue light is not, it's nothing new. Blue light is actually part of the regular spectrum of normal light, daylight outside. What's different now, though, is that we're constantly bombarded by blue light. Blue light is now found in fluorescent lighting, and all these computers and digital devices, the monitors are backlit. So LED screens are backlit with this blue light. So now we're getting the blue light not just when we're outside, but all the time, even inside. Blue light is associated with melatonin release, so it changes our sleep patterns. So, you know, there's certainly an increase in people having difficulty sleeping. That may be a correlation there. And so Zeiss has developed a product called Blue Protect, and it does exactly what it says. It helps to block these wavelengths of blue light, which can be harmful and affect our eyes in many different ways. And by doing that, we can better protect our eyes. What's nice about the Blue Protect is it can be added to any of the Zeiss products. So it can go in the Drive Safe lenses we were talking about, or any of the other Zeiss products.
Tina, as you know, my husband wears the Zeiss Individual. He absolutely loves that lens. Can you tell our audience a little bit about that lens?
Absolutely. The Zeiss Individual is a wonderful lens. We love to fit it. It's one of the most customizable lenses that Zeiss has in their product line. It not only looks at the patient's prescription, but the frame that the patient's going to be wearing and how they wear that frame. And they take all of that and calculate to make it a lens that's individually designed for you. It also has wider intermediate and near areas which reduce head movement. So unlike other progressive where there's a lot of side-to-side movement to find the area of focus, it's right where you need it. It's a wonderful lens.
Now, Tina, I have a friend who wears reading glasses, just needs them for reading. She puts them on, she takes them off. She's constantly scratching the lenses. Is there anything that you would recommend for her to help her save some money?
Well, we're one of the few in the area that carry the Zeiss DuraVision. This is a wonderful product. It has outstanding scratch resistance and high performance anti-reflective protection as well. This gives the patient clearer, crisper vision. It's like getting 2 superior products for the price of 1.
Well, Dr. Hahn, as we know, sunglasses are a fashion statement, but do we actually need to be wearing sunglasses?
Absolutely. So sunglasses are always fashionable, but they also serve a very important health benefit. Most of us are aware of the dangers of ultraviolet light on our skin, but we may not think about what ultraviolet light can do to our eyes. Too much ultraviolet light can cause things like cataracts to form faster, things like macular degeneration risk can be increased. We can get growths of abnormal tissues around the eyes. We can even develop cancer around the eyes. Here in Florida, of course, we're exposed to much more of the sunlight, much more intensity of the sunlight. So it's very important that we're all wearing good quality sunglasses. Most of the sun damage actually occurs before adulthood, so it's especially important that our children are wearing sunglasses. So I make sure that my daughters are always wearing quality eyeglasses and sunglasses from the Eye Associates.
And being on the west coast of Florida, you know, you have a lot of activities, boating, fishing, we go to the beach, we're at the pool. All of that glare needs to, can be reduced by using a polarized sunglass lens. But it's also a safety factor. With our children playing at the edge of the water or in the pool, we want to be able to see them clearly. And with a polarized lens, it reduces that glare and allows you to make sure that your children are safe.
That's very, very important. Dr. Hahn, the self-tinting glasses, we see so many advertisements about the self-tinting. Tell us a little bit about these.
So self-tinting lenses are very popular. They come in different brands. We have Transitions, we have Photo Fusions, and several others. And so these are the lenses that turn from light to dark depending on the sunlight that you're exposed to. I think these are great for a primary lens. You know, you're in and out of the car, in and out of the house, and it has UV protection, which is good for your eyes. What they don't do is they don't replace a dedicated pair of sunglasses. The self-tinting lenses are UV dependent, and so the windshield of our car actually blocks a lot of that ultraviolet light. So that makes it very difficult for these lenses to actually get dark in the car, so we don't have the comfort of the tint in the car. Also, these lenses are temperature dependent, and so they turn much darker in colder climates. Here in Florida, because it's usually warmer, they don't get as dark. So as a primary lens, I think self-tinting is a good option, but we should really have a separate dedicated pair of prescription sunglasses. That's what's going to be the best for the health of our eyes.
We also carry a product that offers the benefits of the self-tinting lens with a polarized lens. It's called Drive Wear. It's an excellent lens. It's a medium polarized color that when it's cloudy or overcast still allows you to cut the glare even though it's not as bright. And then when the sun comes out, the lens does darken and has a wonderful contrast tint. We recommend it for a lot of our macular degeneration patients, again, to cut the glare, and it allows them to see more clearly.
Now, Tina, my husband is a golfer. Are there really lenses out there that could help his golf game?
Well, I'm not sure we can help his golf game, but I know we can get him a pair of glasses that will help him see better on the golf course. Again, we recommend a polarized sunglass lens to reduce the glare and reflection that you get off of the water or the sand. It also allows better contrast to follow the ball on the green. But we also recommend for outdoor activities a wrapped pair of sunglasses. This allows you protection from the sides as well. So when you're outdoors, you have full protection from the sun. And we also want to try to make it as lightweight as possible so that you're not constantly having to push them up when you're outdoors or perspiring.
Tina, my sister actually has lenses that are very thick. Mm-hmm. Is there anything that we can do to make her lenses look thinner?
Absolutely. Patients who have heavy prescriptions no longer have to have the Coke bottom glasses. They are able to put their prescriptions in ultralight, high-index materials. These lenses are 50 to 60% thinner and lighter weight than the standard plastic lenses that we've had for so many years. And another benefit for these patients is that they're not really limited on the frame size anymore. So they're really enjoying fashionable frames, very lightweight, and they're really enjoying the comfort.
Now, Tina, do you carry the frames that bend?
We actually have a pair here. We carry the Flex-On brand, and they're very lightweight, very durable. They do have memory metal in them, so they can take some abuse. And we have them in frames for men, women, and especially for children.
Now, I hear a lot about titanium. What is that, and what does it do?
Well, titanium, as we know, is a very lightweight, very strong, and durable material. It's also hyperallergenic, which it makes it really great here in Florida when, with all the salt air, it doesn't give in to any corrosion. So the frame holds up very, very well. And patients who might have a reaction to other types of metals don't react to the titanium. Even this Flex-On frame that we carry has a titanium base. That's what gives it a lot of its strength.
Oh, that's wonderful.
For my patients who are looking for the ultimate in lightweight rimless glasses, they're choosing the silhouette lenses frames. Those are made of the titanium material that Tina was just mentioning, so they have all the benefits of that she had just said. But they also come in all the new styles and fashions and colors. And so my patients who are wearing those may say it's like they're not wearing any glasses at all.
Well, Tina, as you know, I love the designer lines. Mm-hmm. Do you carry a lot of the designers?
Oh, we do. We have hundreds of frames to choose from, and many designers such as Gucci, Jimmy Choo, Fendi, Christian Dior, just to name a few.
Now, can you also get those in non-prescription sunglasses?
Yes, we have a large selection of non-prescription sunglasses in designer as well as non-designer. They also are fully UV protected, and a large number of them are also polarized.
Now, what if someone's not looking for the designer frames? Do you have some frames that for patients that are looking to save some pennies?
We do. We have frames to fit anyone's budget. Our frame prices start at $39, and we have a frame and lens package that starts at $69.
Now, Dr. Hahn, I know that the Eye Associates has a fabulous guarantee. Can you tell us a little bit about that?
Sure. So we believe in the quality of our product so much that we offer a free 14-month guarantee on both the frame and lenses. That means if you break your glasses, you bring them back in, and we will replace or repair them free of charge. Many places will charge for this type of guarantee, but at the Eye Associates, that's completely free. This even applies to our budget packages.
Now, Dr. Hahn, of course glasses are very stylish, but what about the patients or the people, the audience that are watching that don't want to wear glasses?
Because we do so much more than just glasses, we have many options for them. We have something called a clear lens replacement surgery. We have bladeless all laser LASIK surgery. We do offer free screenings for both of these types of surgical procedures. For someone who's looking for maybe contact lenses, we offer the newest in contact lens technology, in the new breathable plastics that are healthier for the eye, the more moist plastics that can reduce some of the dryness and help improve the comfort on the eye. And so we have many different options for our patients looking for something other than just glasses.
Now, what about the contacts, though, that change the color of your eyes? Do you have those?
We do. We have many patients who have brown eyes and wish they had blue, and we're able to provide them with those types of contacts as well. We also recommend to our contact lens patients that they have a spare pair of glasses. So many times, contact lens patients, on occasion, they're going to have to be without their contact lenses, and you really don't want to compromise your vision by wearing an old pair of glasses that's 2 or 3 prescriptions old. In addition, we also recommend that our contact lens patients wear a good quality non-prescription sunglass. Again, we carry a wide variety of non-prescription sunglasses that filter out the ultraviolet light and have polarized lenses.
And contact lenses have come such a long way now, with the new technologies. We have astigmatism correcting lenses and multifocal contact lenses, and we can do so much more now with contact lenses than what we've been able to do in the past. So contact lenses are a great option for our patients, and we can specialize. We do specialize in hard to fit patients. So patients who have tried lenses in the past but may have had difficulties, we may have new options for them.
Well, and Dr. Hahn, as you know, I wear bifocal contacts. I absolutely love them. But are there new advancements with the bifocal contacts?
Absolutely. So just like all technology, things are constantly improving. So bifocals have actually been around for a number of years, but now the newest generation of multifocal bifocal contacts are so much better. They're better in the type of plastic that we use now, the different types of silicone that we have. That allows that breathability and again the health of the eye, which is so important. These new plastics are much more moisture retaining. The number one reason people drop out of contact lenses is because their eyes get dry and there's too much discomfort to wear them. But now we have better solutions that even patients who have worn bifocals or tried bifocals in the past and maybe couldn't tolerate both the comfort or the vision, we have new options now to help these patients.
So then patients who weren't able to wear contacts in the past really have a lot of options.
Absolutely. They just need to come in, get an eye examination, be fit with contact lenses, evaluated for contact lenses, and then we can see all these new options and how we can help them.
Now, Dr. Hahn, if someone doesn't wear glasses, do they really still need to have an eye exam?
So, great question, because eye exams are much more than just getting prescriptions for glasses and contact lenses. Yes, that's important too, that we keep those updated. But the eye is really a place where we can view what's happening in your body. And so many systemic problems can actually show up in the eyes first. And so it's very important that you come in for annual examinations so we can see the health of your eyes. Oftentimes, eye conditions don't really have many symptoms in the beginning stages. So your eyes may not hurt, you may not notice a change in your vision. But a lot of these conditions, if we can catch them early, we can prevent you from losing vision and save your eyesight.
Well, Dr. Hahn, then how often should someone have an eye exam?
We recommend annual eye examinations to keep up with the health of the eyes. Again, especially important if you do have any systemic conditions like hypertension, diabetes, cholesterol. If you have any family history of eye problems like glaucoma or macular degeneration, it's very important that we do check your eyes annually. And for children, we recommend baseline examinations before they start school. We know that vision and eyes are so closely related, so we want our kids to have all the tools that they need to learn properly. And then, of course, right around the age of 40, even people with perfect vision, they will start to notice that maybe their near vision isn't quite as good as it used to be. This is a perfect time to come in, make sure the health of your eye is good, but also talk to you about all the different options that we have to help the near vision. So we don't have to, worry about just using some type of over-the-counter glass, and we have much better treatment options like Zeiss individual progressive lenses that we were talking about earlier.
Well, Tina, what if someone in our audience has already had an eye exam, they've been given a new prescription for glasses, can they still come in and get the Zeiss lenses?
Absolutely. They just need to bring their prescription in, and one of our opticians will discuss with them how they use their eyes throughout the day, and then they will be fit with the Zeiss lenses that will be perfect for them.
Dr. Hahn, why should a patient come to the Eye Associates?
We do offer customized vision. So we have the multiple treatment options, so we can pick the best treatment for you, whether it be glasses, contacts, or surgery. We have a very strong reputation of providing quality eye care in the area for over 30 years. We have over 15 board-certified physicians. We have certified technicians. We have board-certified licensed opticians. In fact, we have more licensed opticians than any other practice in the area. So these are all the reasons to come and see us.
Well, we're also a full-service practice. We offer eye care, we have optical, we have eye surgery, but we also offer hearing, dermatology, and cosmetic procedures as well. We're a Zeiss certified practice, so we're offering superior products that other offices just don't have available. We also have our glasses, our free 14-month guarantee, and we have free eyeglass adjustments. Even if you didn't get your glasses from us, stop by and we'll give them a tune-up.
So, Tina, where does the Eye Associates actually have locations?
Well, Jill, we are located in West Bradenton, East Bradenton, Sarasota, Venice, Ellington, and in Sun City Center.
Dr. Hahn, what if somebody in our audience is out there watching, what should they do first if they want to get a new prescription?
Well, of course, we have to start with a baseline examination. So we need to make sure that all the structures of your eye are healthy and functioning properly. And then we can talk about all the different options in the glasses and the different types of glasses that may be best suited for their environment and their customized individual needs.
So the first thing is to call and make an appointment.
Absolutely.
Well, unfortunately, we are out of time. Thank you, Dr. Hahn. Thank you, Tina. And thank you, audience, for joining us today. If you still have questions about these and other eyeglass products, just give the Eye Associates a call at toll-free 1-866-865-2020. One of our professional opticians will gladly answer them. Or if you'd like to make an appointment with one of our doctors, we'd love to see you. Our goal is to keep you seeing your best and enjoying your life. So for now, I wish you the best sight for life and so much more.